Further debates. I recognize the member for Ottawa South.
Thank you very much, Speaker, and I'm pleased to speak to the More Convenient Care Act, which begs the question, is care convenient right now? And with 2.5 million Ontarians not having a family doctor, that's not very convenient. And so it might be better if the member spent less time heckling and more time speaking up for the residents of Eglinton Lawrence so they could get a family doctor, right? So, we know it's a problem. Nothing is done in this bill to address it. I'll talk a bit more about it later, but I would like to talk specific to the bill because there are some things in here that are good. I think there's a lot of tinkering around the edges of things where we could have a more effective piece of legislation for things like nursing agencies. I mean, I guess we should all be thankful because it's only taken a little more than 2 years for them to actually recognize that, there's a problem with nursing agencies. I might as well start talking about this first. And what they propose in here is really essentially record keeping, and a fine for not keeping records. Nothing about the action that you're going to take to reduce gouging, excess charges, private health care benefiting more than public health care. It's just record keeping. That's all. You got to tell us this. You got to keep it on record. And if you don't keep it on record, we're going to fine you. But you're not doing anything about the essential problem, which is the almost $1 billion that we spend on nursing agencies. You're not going to fix it with that. What you're saying is, give me the receipts, and then you're going to put them in a desk. Not going to work, right? Not going to work. I mean, you got to know, this is, I don't want to, pardon my English, crap on this bill, right? I know it's on the edge, Speaker, but it's just like, it's not, we have some big problems in Ontario's healthcare system right now, and one of them,
To the member, I recognize the member for Essex.
Could you once again kindly remind all the honourable members to use parliamentary language?
Okay. We'll ask everyone in the House to come to order, and to the member from Ottawa South, let's raise the bar. Please, let's raise the bar. If we want respect, we must speak to our colleagues. Please don't interrupt this. Would the member for Ottawa South not interrupt the Speaker when the Speaker is speaking? That's all right. Please, let's use parliamentary language and respect colleagues in the House. Thank you.
Well, thank you very much, Speaker, and it's good to get a fresh start on this. In the nursing agencies part, folks, you're just asking people for receipts. Tell them to keep records, and you're doing squat. I think that's okay, right? Squat. I just wanted to check. I think the measures for nurse practitioners, the expansion of their scope, good thing. Makes it possible for us to vote for the bill. Blood testing, I agree totally with what's being done in this bill. Now, I got to ask, the Health Protection Promotion Act, in terms of the medical officer of health and class orders. It's interesting that this is in here. We could debate whether that's something that's really necessary, that's important. It comes out of the pandemic, and basically taking power away from public medical officers of health, local people who are trying to address the critical situation that they have at a certain time, whether it's with something like COVID or another infectious disease like monkeypox. So my concern is you're taking this power away, but you may slow down the process of taking action. I don't think it's, like I say, a hill to die on, but that's the question that I have. But the biggest question that I have is why, when 2.5 million Ontarians don't have a family doctor, and when 3 million other Ontarians are at risk of losing their family doctor because they're over the age of 60, right? That this government isn't doing something to address primary care now. No, not asking nursing agencies for their receipts, but figuring out a way to get everybody a family doctor. Now, I know that the government has called in another expert, and I can remember a few other experts. Maybe all of you can as well, too. So I remember the blue ribbon panel for post-secondary education. And they came with some recommendations, and I'm sure they're in somebody's desk somewhere over there, but they're not actually being implemented. And a friend of mine, Jack Hitz, did a long-term care report. You might remember that, 84 recommendations. I think only one of them was followed. And that report is, I'm sure it's in another member's desk over there or in their office. It's just sitting there collecting dust. And then there was the housing panel. Tim Hudak. I mean, he used to sit right over here. He was like on your side. He was the guy who was going to come and fix housing for you. He was going to make recommendations. What happened with that? Nothing. Nothing. Climate change panel. Somebody's desk over there as well, too. So the way this government works is we've got a problem, it looks bad, we've got to do something, we want to make it look like we're doing something, so let's get an expert. Let's get an expert that everybody recognizes. And let's get ourselves through the next 3 or 4 months. And then after it's done, in the desk. Nobody sees it, doesn't see the light of day. The lack of access to primary care is causing a lot of the problems that we have in our healthcare system. It's causing increased wait times in emergency rooms. It's taking longer for people to get the next level of care they need if they have something like diabetes that's not diagnosed, or they have a cancer, or they have another chronic disease. If you don't have a relationship with a primary care physician or nurse practitioner, and you're sick, it's really hard for you to get the care that you need. And I know that the members opposite don't like, when I tell the member from Essex he's got 13,000 people in his riding who don't have a family doctor. 13,000. That's a lot of people. So, and I know we get heckled. And I don't want to have to pull out my list again, but I can, because if people need to be reminded, I'm more than happy to do that. So, and I appreciate that.
To the member, I apologize for interrupting the member, but we do not use props in the House. I will remind the member, we do not use props in the House.
They put one on my desk every morning. I'll just put it down. I won't hold it up. It's just a map, so I know where everybody is. So the member from Eglinton Lawrence, 19,000. It's just a reminder, okay? Anybody else put up your hand if you want to know? Nobody's putting up their hand? He's good. You're about 2,000. That's where they do it right. He's good. Premier's riding, 32,000. Etobicoke, 100,000. Minister, 10,000. It's good. It's good in the bad, if you know what I'm saying. But everybody needs a family doctor. So why isn't the government going out and saying, here's the commitment we're going to make to do it, and here's how long it's going to take us to do, and we're going to guarantee every one of you a family doctor or a nurse practitioner, and we're going to build teams. No, what do? Let's get another expert. I like the expert that you've got. I think they're going to be very disappointed with the results that always happen, which is in the desk, gone, collecting dust, in exile somewhere, all the work that people do. I mean, it's so bad that a person who led your party was asked to do something on housing, and you ignored him. What does that say? What that says is you weren't serious. You weren't serious about actually taking the advice of other people. The reason you were asking for his advice was so you could write it in a press release and point over there when somebody asked you a tough question about housing or long-term care or climate change, right? Or post-secondary education. Oh, they're taking care of it. It's not us. They're going to give us recommendations that we're going to put in our desk. So what I would be encouraged if the members opposite would say to the Premier and to the Minister of Health, we got a big problem. We got a really, really big problem, and we need to do something about it. And we need to go to the wall for it, not appoint another expert. Not appoint another expert. So, I'm going to support this bill, but I want the government to know that they're not fooling anybody with another expert panel. Government needs to say, government members need to say, and if they want to find out how many people in the riding don't have a family doctor so they can say it this way to the minister and to the premier, we got a big problem. It's hurting people. It's hurting my neighbors. There are people who are going to lose their family doctors. We don't have a plan. We're not making a commitment. Minister, Premier, I need you to do this. I need you to do this because the people in my riding need this. If you don't have a family doctor, it's hard to stay healthy. It's hard to get care for a chronic disease. It's hard to get a referral. And then it's hard enough to actually get there, right? I think, 11,000 people died on a wait list last year. The crisis in family medicine and in primary care should be at the top of the list of this government. Finding everybody a family doctor is more important than banning bike lanes. It's more important than having a map to show everybody where they can get booze in the corner store and spending $1 billion to do it. Right? It's more important than dreaming of a fantasy tunnel under a highway 30 years from now. The problem is right now, Speaker. The problem is right now. The government needs to address the shortage of family doctors and make a commitment. I know they're not going to, because they keep skating around it and they appointed another expert so they can put the report in their desk. Are we good? Are we good? I still got a little bit left? Okay, I just wanted to make sure. I'm not done with y'all yet. I want the government, and the people in your ridings do, and the people in my ridings do, want you to address the primary care crisis. Because it's going to fix a lot of things that are problems in our healthcare systems, like emergency room wait times, like wait times for referrals, like managing chronic diseases. It's a big problem, folks. And I know there's a lot of...
I apologize to the member, but it is now time for member statements.